My name is Nichele Salazar. I'm a certified nurse midwife here in the Four Corners. I graduated from the College of Nursing in 2014. I serve a lot of people from my community, which is the Hickory Apache, Dulce, New Mexico. I serve a lot of people from the Farmington area, Navajo Nation. Everybody thinks all we do is pregnancy, catch babies, postpartum care, but we actually do a lot more. We take care of women throughout the seasons of their life. So that goes all the way from menarche all the way up until menopause. Being a midwife of color is just being somebody that comes from areas where we can provide more education about how to care for our populations, which sometimes are lacking within the data or lacking within the literature. I can kind of give guidance on how do we address these people? How do we address our Indigenous people to the point where it's respectful care? Sometimes it's learning the language. It's learning the language of body language. How do we cross that wall? And sometimes that's just sitting there listening and saying, hey, you know, I hear that you have had some hard times. How can I help? So then that way you get that information. And like I said, sometimes it's just sitting there listening, not even saying anything, giving them that time to process. They do say that those who live in rural areas, the likelihood of them going back to those areas are very high. So that's what we want. We want to continue to promote that. We need more midwives of color. We need more women from rural areas. There was so many more resources within UNM that helped me continue, that helped me get through anatomy, pathophysiology, some of those harder courses that tend to make us feel, oh, maybe we're not made out for this. But no, there's resources that are available. Once you get past those hard classes, then you're able to actually shine and get to do what you really want to do, and all of it comes together. There are times where traditional medicine is super important and a big part of somebody's life, but also adding in a little bit of Western medicine to help, you know, build that dyad forward or that family forward. How do we learn to merge them where we still treat the person holistically? So we need you to help us close that gap. You are the answer to bridging both of those together for patients.